And we move over to the health sector. Mental health practitioners have called for the implementation of the Mental Health Act to provide citizens with a mental health plan and policy that will offer guidance on the implementation of the act. Now, this was disclosed at a press briefing in Abuja with the recommendation that criminalizing attempted suicide should be expunged from the nation's law book. Our correspondent has this report. President Muhammadu Buhari finally signed into law the Mental Health Bill 2021 after two failed attempts in 2003 and 2013. The bill, which was harmonized by both chambers of the National Assembly, is the first legislative reform adopted in the field since the country's independence and will also replace the Lunacy Act of 1958. To this end, these professionals in the sector and human rights activists are passionate about the implementation of the act.
There should be a public awareness of this bill and what it signifies, because a large percentage of the population, including mental health experts, have absolutely no idea what is contained in the bill, obviously. There should be a special training for law enforcement, legal practitioners, legislators, and general medical practitioners on what this bill entails, because, to be honest, it is alien to us.
We would like to see that every stakeholder has a part to play in ensuring that this Mental Health Act is implemented.
They stressed the importance of the bill and the need for proper sensitization and more awareness.
Section 13 of the Act expressly upholds employment rights, as earlier mentioned. It provides that a person with a mental health condition can engage in gainful employment without discrimination and can equally access the mental health department.
These practitioners are of the view that the section criminalizing attempted suicide should be amended while stating the advantages of the mental health bill to Nigerians.
And we think that a lot needs to be considered, especially for those with disability, to ensure that we have sign language interpreters in these centers to make sure that people with disabilities have access to mental health care.
Still holding on to the archaic law, So this is why this section, like I had said earlier, needs to be expunged. And then we now have to look into, okay, so how can we help the citizens? You're speaking about mental health. When the economy is not working, how can we say you have a good mental health?
Yeah. Officials flagging ceremony will help propagate that in a positive way. It also will bring it out of the shadows.
Part of the recommendation includes a set of actors to checkmate the implementation of the law, budgetary mobilization, state parties to domesticate the National Health Act into the region, more awareness, among others.